Okay, good afternoon, everyone. Pleasant good afternoon to the media here with us, and good afternoon to our listeners on Radio Turks and Caicos, as well as our viewers on the Office of the Premier official Facebook page. Thank you for joining us here today. Today's press conference, the Premier, Honorable Charlene Cartwright Robinson, will be joined by the Minister for Health, Honorable Edwin Aswood, and the Minister for Tourism, Honorable Ralph Higgs, to bring updates on TCI's COVID-19 response and risk reduction plan, as well as the reopening of the TCI borders. Immediately following the press conference, the Premier and the ministers will take a few questions from the media. To the media, we ask that you use either the two mics to present your questions and state which media house you represent before doing so. The Premier will bring remarks first, followed by the Minister for Tourism, and the Minister for Health will be available to take any questions from the media. And I invite the Premier, Honorable Charlene Cartwright Robinson, to address the nation.
Good afternoon, everyone. I acknowledge the presence, of course, of my ministerial colleagues and the Deputy Premier that is here with us in the room. The Minister of Tourism will offer a few remarks, and both he and the Minister of Health will be available to answer any questions. I want to also acknowledge the presence of the Permanent Secretary for the Ministry of Tourism. She would be able to assist our Minister as well. This week we approach a new phase in the reorganization of our society, and indeed the economy, as we deal with the realities of this new normal in this COVID-19 environment. Through each stage of this pandemic, and even though through challenges and difficulties, we have always been determined to find a way, while staying true to the science, to get life in our various communities back to an acceptable operational level that will allow our people to strive and succeed without taking unnecessary health risk. This week provides a new challenge but a huge opportunity. Going forward, success depends on following and observing all the protocols, exhibiting responsible behavior, and a new community consciousness that does not allow any of us to act recklessly or without regard. Transitioning to Phase 3 on the island of Providenciales, where curfews are lifted and businesses are allowed to operate, begins today. Today, churches and the remaining businesses in the local economy are opened. Hotels, dining-in facilities, gyms, casinos, spas, discos, and local travel. This does not mean that all the dangers of COVID-19 are gone. It means that we are prepared to operate in an environment where protocols are extended and all safety measures are taken. We urge all to please follow the protocols. Keep logs to assist your contact tracers. Protect your congregants and staff, and be a vigilant player in this fight. This, together with the opening up of the international airport on Wednesday, is a leap of faith in the ability of all of us to abide by rules and protocols and to be responsible, if not to us, but with each other. We are ready to announce to you and the population and the wider community that we are indeed open for business and our local economy is coming back. While there are no restrictions under Phase 3, we want to discourage non-essential inter-island travel. I strongly encourage this and would also wish to strongly encourage a delay in the opening up of dining-in facilities at restaurants and to strongly encourage outdoor dining and pickups. We must go above and beyond in our stewardship. There are those who question the opening, and if we were opening a few weeks ago, there will be those wanting to remain closed, and if we were opening a few months from now, there will be those who wish to remain closed and who question why now. The truth is, fear is real. And whilst we must be cognizant of all the information available, one thing we are confident in is the fact that COVID-19 is not going away right now, and we must learn to coexist. No matter when we open, COVID-19 will be there to face us all. We cannot afford to be paralyzed by fear, but we must follow health protocols, in particular, the proper wearing of masks, the proper washing and sanitization of hands, and the proper sanitizing of frequently used spaces and devices. The opening up of the economy should not signal the lowering of our guard. This virus is real, alive, and painful. We have to be vigilant and disciplined now more than ever. We remain confident that once we remain disciplined and committed, and once we follow established protocols without exemptions, that we will not have widespread community spread of COVID-19 in our societies. Our efforts can only succeed and our people can remain safe with each one of us playing our part. In regards to the opening of the airport, we are satisfied that all the means have been taken to ensure a safe and secure environment and for us to mitigate the risk of importing the virus. As I did with local travel, I wish in the strongest terms to discourage non-essential travel overseas, especially to hotspots. We draw our attention to our neighbors' recent experience, where the spike in the country was contributed to residents with recent travel history to Florida. I'm calling on all residents to resist the urge to engage in non-essential travel, particularly at this time, to Florida. We strongly discourage non-essential travel, but state clearly that only persons with a COVID-19 negative test will be allowed to re-enter the Turks and Caicos. On Saturday, I accompanied members of the Airports Authority and the media in a walkthrough at the Providenciales International Airport to review the airport's preparations ahead of the reopening of the country's border this week. There were several upgrades to the facility, which include the installation of signs and hand sanitization stations, as well as social distancing demarcation stickers and PSAs, which can be reviewed on the information screens throughout the airport. All improvements were guided by the Ministry of Health. The Ministry of Health, which will also oversee screening at the airport, has an on-site station and have introduced a temporary quarantine room. In the weeks leading up to the reopening, there has been several simulation exercises where staff at the airport underwent the full procedure of processing arrivals. I must state here that earlier today, myself and my colleagues, the Honorable Ralph Higgs, the Honorable Vaden Williams, Minister with Responsibility for Immigration, and the Minister of Health, Honorable Edwin Ostwit, joined the Deputy Governor in a brief meeting with staff that work at the airport in Providenciales to assure them of our support and our commitment to stand by them. We are confident in our preparations for the reopening of the country's borders and are excited to welcome our guests back to the Turks and Caicos once more. Health remains confident in its protocols that once followed, we will have the best outcomes, and we draw on that confidence. On Saturday past, we would have launched our TCI Assured portal. We are positive that although the coronavirus pandemic has shut down a lot of borders, that numbers of visitors to the TCI will still be strong. We are grateful for all our travel partners that have committed to providing air travel to the destination. The airlines reported last week remain as scheduled to return. The majority of our major accommodations providers will open. Persons will also be aware that our largest member in the accommodation sector will not be opening in July. Over the past weeks, tourism, road safety, and health have completed critical inspections, and TCI Assured stickers began issue on Saturday past and will continue as persons submit their COVID-19 plans for approval and inspection. I continue daily briefings and I'm kept informed by critical agencies as to the details. There will be a lot more signs and PSAs that will be rolled out before the reopening to remind persons of the health protocols. Thanks to Team Health, who have been working along with the TCI Airports Authority to ensure that we are able to welcome our guests and return residents safely into the islands. The Turks and Caicos Islands will reopen its borders to regional and international visitors on 22nd July, and there will be a water cannon welcome for the arrival of the inaugural flight with limited guests to mark the occasion. We have some of the strictest protocols in place for arriving passengers, which include the cost of testing at the point of origin. No one will be allowed to enter the Turks and Caicos without having a negative COVID-19 test. And we see where some of our Caribbean brothers and sisters are reversing their more liberal positions to where we are. We believe this approach will bear as foolproof a measure as we can achieve under these circumstances to ensure that we do not import any cases. In the last few days, we recorded 6 new confirmed cases of COVID-19. 1 is a returning resident, and 5 are contacts of other known confirmed cases. The number of active cases in the Turks and Caicos now stands at 57, with 1 case currently under hospital care. The public health team is continuing its implementation of aggressive contact tracing and control measures in relation to all active cases. We have, however, over the past days seen a huge improvement in hospital capacity with release of COVID-19 patients and other patients. We have also seen recoveries now being recorded with more in train following the completion of the retesting protocols. The number of persons in quarantine or observation has decreased. The number of confirmed positive cases identified in the Turks and Caicos, however, is 81. The total number of recoveries remain at 21. No new COVID-19 related deaths have been recorded since the previous update, and total COVID-19 related deaths remain at 2. To date, the Turks and Caicos has recorded a total of 1,016 test results, with 935 confirmed to be negative and 81 positive confirmations. Testing will expand over the weeks, and we remain committed to ensuring that private labs are a part of the COVID-19 response. Local testing is being conducted for persons in a range of categories according to the national testing strategy. This includes frontline workers and those who may need to travel for treatment abroad. These persons will not be reflected in quarantine numbers. We note with regret, though, that over the past few days, there were 3 COVID positive patients who fled quarantine and were sought by the authorities. We also note that only 1 remained at large, and we make a public appeal to this individual to do right by yourself and your community and report back to quarantine. That is the only way that you can protect yourself and your loved ones. And family members, we must encourage this person also to return to quarantine to save themselves and the wider community. I cannot say it enough. We need the cooperation of all if we are to succeed in this fight. Are we ready to open? As ready as we will ever be. Whether we open on Wednesday or months from now, COVID-19 will be here, and we must learn to coexist. Will cases increase? Perhaps. Will we import any? Perhaps. Have we positioned ourselves to mitigate these risks? Yes. But it is truly, truly a responsibility on all of us. I join with health and strongly encourage the public to follow all of their advice and guidelines, especially as we progress with the phased reopening. Let's continue to reduce the risk by washing our hands, wearing masks properly when in public places, practicing social distancing. Prepare your home, office, and other surroundings by following the advice of the Ministry of Health and other credible health agencies. Cover your coughs and sneezes. Keep frequently touched surfaces clean. Protect those who are vulnerable in the community, such as the elderly or those with underlying conditions, and do not discriminate against persons who have or are suspected of having COVID-19. We are calling for the complete cooperation of everyone if we are to be successful in this fight against this invisible enemy. If we do not observe the protocols, it can force us to return to the days of lockdown and curtailed economic activities, options we are prepared to use if needs be. I know many of us are fearful as well as many are excited. Among us all, I ask that we recognize that this rests squarely in our hands, individually and collectively. We must do this together, and I know that we can. May God continue to bless us all, and may He continue to bless these beautiful by nature Turks and Caicos Islands. And I will invite the Honorable Ralph Higgs just to give a snippet on the portal and the TCI Assured program. Following him, we'll invite questions. The Minister of Health is here. The Minister of Tourism and his team will also be able to answer questions. And can I suggest, can we have one person at a time have all the questions fielded to them so that we are not back and forth to the podium? Thank you.
Thank you, Honorable Premier. Good afternoon, everyone. Good afternoon to those of you watching via social media. I want to associate myself strongly with the remarks that the Premier has made, and I would like to further reassure the local public and the traveling public that we have put in place every measure humanly possible to ensure the safety of our guests and the safety of our residents, our host population. I believe from a tourism perspective, our destination is definitely ready for the reopening of our borders on the 22nd of July. And I'm delighted to be a part of a dynamic team that has worked tirelessly to ensure the readiness of our country. We have collaborated extensively with countries in the region and indeed the world. Where possible, we have adopted best practices and have had those tailored towards our local situation. You would be aware, and I have invited the media present, and I've extended an invitation to those who are listening to earlier press conferences to visit our portal, the TCI Assured portal. I'm pleased to report this afternoon that that portal has gone live worldwide, and wherever you are in the world, literally, wherever you are in the world, that is serviced by any IATA carrier or any IATA travel agency or any IATA registered business, you can access information on Turks and Caicos. From the comfort of your home or from the comfort of your office, you can access TCI Assured portal and see what is required of you to travel to the Turks and Caicos Islands. Many of you would be aware that the regulations for entering the Turks and Caicos requires that you have a COVID-19 negative test within 5 days, PCR tests, that is no older than 5 days before your trip to the Turks and Caicos. And again, from the comfort of your home, you can supply or provide that information on your TCI Assured portal. Again, you're required to have an insurance policy that provides for hospitalization, should that become necessary in the country, that provides for Medevac out of the country, should that become necessary, and it provides for doctor's visits, prescription, and everything associated with any illness that may arise as a result of COVID-19 while you're in the Turks and Caicos. You must also upload that information, your medical information, your health insurance information, on our portal. The portal is quite easy, very user-friendly, and we have been told that within 3 to 5 minutes, all of the information that you need to travel to the Turks and Caicos can be uploaded via the TCI Assured portal and transmitted to local authorities, which will then assess that information and then provide approval for you to travel to the Turks and Caicos. Let me say, if you are a visitor or a resident and you are not on any exemption list that is approved by the Chief Medical Officer, you would be required to have a pre-travel COVID-19 negative test, and you would be required to show proof of insurance if you are a visitor, or if you are a resident, you must show that you are a holder of NHIP card, which will cover you obviously on your return to the Turks and Caicos Islands. I am very pleased with where we are at this stage, and as you know, this is a very fluid situation, and like the Premier alluded to earlier, many countries in the region have had to adjust their strategy. So we are going boldly into this reopening, confident in all the steps that we have taken to protect and to mitigate against any fallout, and if it needs for us to adjust, we will have to adjust. The world is adjusting. The great United States is having to adjust. This is certainly unprecedented, and there is no blueprint to follow. Let me say, Turks and Caicos, you are our greatest asset. And as you go about over the next few days greeting and providing service to our guests, we want you to do it in the traditional, hospitable way. While they may not be able to see the smile on your face, you probably know that a smile starts in the heart, and they can feel that smile. If you're providing service with a smile, they will be able to see it. You can give them that virtual embrace, not a literal embrace, but a virtual embrace, to show them that you appreciate that they would have taken the time to come to the Turks and Caicos Islands, particularly during this time. So, from a tourism perspective, we have done everything we can since the borders were locked down to ensure that the Turks and Caicos remains visible and remains relevant. Persons are responding positively to Turks and Caicos message, and we already have a number of registrations on the TCI portal. And you can appreciate that in the days immediately following the opening, the numbers will be light, and we expect that they will grow from strength to strength as people become more aware of and more reliant and more confident in the protocols that have been employed across the region, and particularly in our destination. We believe people will continue to patronize the Turks and Caicos. So Turks and Caicos, again, I want to encourage you to be good host as you have been over the years, and we want to encourage you. I appeal to you to deploy all of the protocols that have been put in place by TCIG and the Ministry of Health: social distancing, wearing of your mask, frequent sanitizing of your person and your hands, cleaning of your work areas, etc., etc. And if we do those things, I believe we can help to beat back the spread of COVID-19 further. And I believe that our visitors will be able to come to Turks and Caicos and enjoy the good times that they have had, and we can make new ambassadors of Brand Turks and Caicos moving forward. I pray that God will continue to bless our beautiful Turks and Caicos, and I pray that all of us will play our part to be good ambassadors of Brand Turks and Caicos. Thank you.
Okay, I now invite questions for the Minister for Health, if there are any.
Thank you very much. Start with the questions. Yes, ma'am.
Media.
The drugs that are provided are all the generic drugs that we had from before. However, we have been hearing of new drugs, new wonder drugs that are said to be cure-alls or can cure. And until we have those things FDA certified and regularly clinical trials take place, we will not be using them really in the Turks and Caicos to experiment. So we are looking at those wonder drugs out there and thinking on waiting until all the clinical trials are completed before we look at, bringing them into our system.
So just a
Follow-up to that one. So even the ones that the delegate...
For the formulary that is presently at the hospital, we can get that from the Enter Health Canada and look at their formulary and provide that to any members of the media, the formulary that they're using right now on all their patients. Okay, thank you very much. That is a wonderful question. Expansion means that we are expanding the number of technologists that we have inside of the lab. For that is a labor-intensive methods preparing and extracting the samples. So even though we have machines that can literally do about 200, 300 tests per every couple of hours, but you need to physically prepare those samples to run on the machines. If you have one technologist preparing those samples, one technologist can maybe prepare manually about 25 to 30 samples per 8-hour shift. If you have two technologists preparing samples, that will increase to 60. If you have 3 technologists, 90. Also, when we are looking at the automated extraction kits, when those automated extraction kits come in, it will also increase the capacity of the laboratory. So when we look at expansion, human capacity, and also automation.
And what does it mean about
the community testing? We were there. We were there. However, just like every country in the world, when you have outbreaks and investigation, you have to move from testing asymptomatic persons who are not showing any symptoms or just wanted to travel, to go to the hotspots. You have to fight the war that is presented to you. And once you have a surge in cases, you have to divert your resources to finding those persons who are infected, who are sick, the contacts of those persons. So even though we want to test everyone, once we have those cases evolve, you have to divert your forces to them. And hopefully, like the United States, let me give you some stats. The United States have about 13,944 hospitals and have over 6.6 million hospital employees. And you see what they have. And when it comes to labs, they have over 335,700 medical laboratory technologists. And you see the trouble that they're having, and persons cannot get a test in 10 to 12 days because they have to divert their resources from community testing to, deal with the pandemic, the outbreak. Also Jamaica, right? Our neighbors in the Caribbean. Right now, if you try to get a test in Jamaica, it's going to take about, they're saying they are not testing people unless you are symptomatic or you are contacts of contacts. Right now, happening in Jamaica. And Jamaica have 46 private labs, 52 public labs, and over 300 and something laboratory staff. And they're saying that, look here, we have to divert all our resources to the outbreak first, and then we'll go back to regular testing. So as soon as we deal with all the outbreaks, we'll go back to the regular testing.
And in the question of the private labs, in the private testing, so then are we going to get those institutions involved? How many may have applied?
Yes, thank you very much.
Right.
Again, it is our goal to have as much private labs up and running as possible, because that will take the burden off of the government. We can focus on the outbreak while the private labs focus on persons who just want to get tests or need to travel or so. So we want to get them updated, but we cannot go and cheat the standards. If there are standards in place that need to be met, we have to ensure that those standards are met. We want them up and going. So as a political arm or Minister of Health, I cannot say, look here, I want you, bypass that requirement. As the requirements come up, we want persons to meet the requirements, that the public and both the regulatory bodies can be sure that whatever test results come out of those facilities, they are 100% accurate and can be relied on. So there's a process, a procedure. Our laboratories went through the whole validation process. That's when members of the media was beating us up that we said that we were going to have testing ready, but why we're lying and this and that. Not you guys are cool, but the other guys were saying that, So they have to go through this validation process, and that is what is going on now. And the validation process, just a quick example, you need to have a panel. Most of the panels are commercially prepared. That's so much positives, so much negatives. And you have to test that in your system. And not just one day, you have to test them a number of times and over 5 days. And if you have any incorrect results, you have to do that for an additional 5 days. But to get those commercially prepared panels to do the validation is difficult at this time. Most companies are saying that, look, if you're not a national government or a national public health lab, we're not going to give it to you. So right now we're trying to get the help of Public Health England to get so much of panels, tests and panels for validation down to the Turks and Caicos Islands, so that when our private labs need those panels, they won't have any difficulty getting them, and they can get up and running very soon, so we can take some of the burden off the government, because we want them up. And especially me, I want those labs to be up and running as soon as possible.
Can you say at this point what kind of interest there is in it from the private sector?
Yes, we
Like
have.
how many?
Yes, we have one fully private laboratory as it is here in the Turks and Caicos Islands, Providenciales, that has applied. We have doctors' offices that does some lab investigations. However, when you come to PCR testing, you need to be a medical technologist. You need to have a biosafety cabinet. It's not just on a desktop at a governor's office. There's a lot of safety equipment that needs to be in place. So while some basic laboratory tests, yes, you can do it in any doctor's office. But when it comes to PCR testing, especially with infectious substances, it's a different ball game. And you need to be in an established laboratory with medical technologists, not just some few technicians who train to take blood or phlebotomists. You need to be a full-fledged medical technologist.
How ready are our public facilities, our clinics in the family islands, the sister islands, for any potential situation with a COVID-19 positive or person even symptomatic in their island?
Well, they can deal with the regular persons with normal symptoms, but when it comes to persons who really depend on HDU units and stuff, that is at the Cheshire Hall Medical Center and the staff here. Grand Turk has a HDU unit. Of course, we don't have that kind of facilities in the family islands. We only have two hospitals here in the Turks and Caicos Islands, that is in Providenciales and Grand Turk. But for the regular, just the basic symptoms, yes, we can deal with that. But when it comes to persons who need to be hospitalized, that is going to have to be either at the Cockburn Medical Center or the Cheshire Hall Medical Center here in Providenciales.
So just so we get a clear understanding of what happens in the family islands. The person is symptomatic, can they be tested in, say, a South Caicos? Or will they immediately be
the swab can be taken from anywhere in the Turks and Caicos Islands. And so instead of taking 15 minutes to reach to the lab, it'll take about 45 minutes to an hour, depending on how soon you can get on a plane. But anybody in the Turks and Caicos can get swabbed and tested from anywhere, and those swabs sent to the reference labs. Make sure before I touch anybody.
We now invite any questions for the Minister of Tourism.
Yes. You battle.
Once bitten, twice shy, I guess.
Yeah, just, should I do this above the board so people can see I am practicing?
Okay, we learned that Beaches Resort is not opening, and usually in tourism when we have Beaches Resort is not opening, we are concerned about what that will mean with air travel and air carriers, and whether that will impact how many flights are actually coming in. What does it mean for us that Beaches is not set to open on the 22nd? And do you have a date as yet?
Well, clearly Beaches is our largest accommodations provider here, and that will have implications on lift. We, in some way, it may be, I want to say, a blessing in disguise, because we now can test. We now can put all of our system to the test with numbers that may not be as taxing on the system as we try to work out all of the little nuances associated with a new system. I am told that Beaches has not officially communicated a reopening date to TCIG. We certainly hope that that will be communicated to TCIG in short order. They're an important part of our accommodations offering, and we're looking forward to getting that date hopefully we would have built even more capacity into the system to accommodate the increase in arrivals that will associate beaches opening.
And occupancy levels generally, what are we looking like going into this first week?
Well, different properties are reporting different levels of occupancy. We are expecting a more comprehensive report from the resorts over the next few days, particularly as persons would have registered on the TCI Assured portal and would have gotten their approval and their good to go signal. And then we believe that we will be in a better position to get that comprehensive report from our hotel partners, our airline partners, and we will be able to get additional information from the portal. As you know, the portal only went live on Saturday, and because you must upload your pre-travel negative test within a 5-day window, that 5 days, I think, was yesterday, and now we are seeing more and more persons being registered on the system. So perhaps by the end of business today, tonight, we'll be in a better position to say what that equates to in terms of occupancy level at our resorts, but a number of persons who would be registered to travel here on the opening date would no doubt be some private villa owners, private home owners, some residents, and I think once that has been dissected, we'll be able to say what the accommodations occupancy level would be like.
So, which islands can expect guests?
It is probably a little earlier because the portal does not necessarily require, does not particularly ask for which island you're resident on. We can dissect it down further because you have to give information of where you're staying, etc., etc. So we'll be able to say which island persons will be traveling to once we've done a further analysis of the portal. And I think that is a very good feature of the portal, by the way, because even before persons arrive in the TCI, we can go and analyze, when they're coming, where they're staying, and get some good insight into our guests.
I heard it said that there's an insurance that visitors can tap into. I don't think many people know about that. Explain what happens there.
Yes. Traveling to the Turks and Caicos, the regulations require that you must have a medical insurance that covers hospitalization, quarantine, if that is required, doctor's visit, medevac, etc., etc. We have since the amendment to regulations in Cabinet on Saturday, we've uploaded a number of insurance companies that are providing insurance to the region and indeed to the wider world. So again, I would like to encourage you to go on the portal, or those persons listening or visiting via social media to go on the portal, and they should be able to see a list of all of the companies that are providing insurance to the Turks and Caicos.
Break down first, Minister, because I know we've chatted sort of off the record. Break down what that insurance actually provides.
Well, it is mandatory that insurance provides hospitalization if it becomes necessary, quarantine while in country if it's necessary, and if it is advisable that you be evacuated or medevaced, that insurance covers that as well.
Was any considerations given to suspend flights from the U.S., DR, and Haiti?
Well, there's been no restrictions on suspending flights from any particular destination. We believe that the pre-clearance requirement or the pre-travel requirement for Turks and Caicos will help to mitigate that risk. But in Haiti and the Dominican Republic, there are a list of bona fide labs where people can go and get their pre-travel tests. And there will also be, in the United States, obviously, some of the biggest labs operate there. We believe that the requirement for a COVID-19 negative test within the window of travel is a great mitigating factor to traveling to Turks and Caicos at this time, as it relates to the COVID-19 virus. Yeah, I see my PS looking like she wishes to compliment or add something. And I must say that the PS, as you can appreciate, has been the one really leading the charge on the insurance matter and can give you from A to Z as it relates to the insurance. Yeah? Please, PS, if you got something.
Good afternoon, everyone. I was just shaking my head and nodding to the minister that he was on target. But just to say that because we just had the regulation amendment, if you go now to the portal, you may not see those references, those insurance references. But certainly within the next 24 hours, you'd be able to see references for insurance that will cover the areas that we have asked for in the regulations.
What's going to happen with water sports? I know when we were under the extended lockdown for providentiales, we were told 4 people from a family could go on a boat. Is that still standing? Because we know when it comes to our waters, people want to get on them, get into them, and our boaters, our water sports operators are probably eager to get started. But what are the sort of health protocols when it comes to that activity?
Well, we are now in phase 3 of the opening, and essentially everything would have reverted to almost pre-COVID-19 situation. However, regulations do require social distancing, clearly hand sanitizing, wearing a face mask, etc., etc. So water sports operators will be inspected by the DECR and the health department to ensure that they have the appropriate gear and the ability to provide and comply with the required protocols to enable them to provide service. And again, once they have been checked out and deemed ready to provide that service, they would receive a TCI assured sticker to show that they are compliant, in full compliance with the regulations. And as I said on Saturday when we unveiled the numero uno sticker at the airport, the sticker does have a QR code which enables us, if not in a real-time way, but if the need arises for us to get a sense of where persons would have visited, we can activate that and see where people would have gone. And the good thing about that sticker too, and I've also said that in the COVID-19 era, that more and more people will be very conscious of their health and the environment they are in. So I want to take this opportunity to appeal to all service providers now to be sure that they are adhering to the regulations and the protocols that are in place, because your guests and your patrons would be watching and they would have the ability to report, almost in real time, if you're not compliant with the protocols that govern your particular sector.
And I think I have a question related to government facilities and how the workplaces are set up. I don't know if Madam Premier takes this. But just I know we're back. I know we're back into regular, I guess our regular new normal now. So does this mean that, okay.
Sorry, I think this is important about the travel portal. And everyone should know, visitors and residents alike, that that requirement is for everyone, visitors and residents, and so that you will not be able to board a flight returning to the islands if you do not have the travel authorization. So this is a message that we want to spread as far and wide as possible, that you have to go to that portal, go to the Turks and Caicos Tourism. You will see a button, or whatever the technical word is, but you click on it and you would go in for the application and the registration purpose. And I also want to say that not everyone who goes on the portal to register will be granted the privilege of traveling to the islands because it is a risk mitigation tool. And there are persons who have gone on the portal and they have placed incorrect, erroneous, even crazy information there that we have to say, no, this is not acceptable. It's not a PCR, not just a COVID-19 test. It's a PCR test that the minister help us to also certain that that's the right thing. So those things, they're very important for persons to know. So go to that site and get familiar with the information that is there.
I filled out, I used the site, and I posted a picture instead of a test, so I'll see what you guys say to me. I didn't put a test at all, so I'll let you know what they tell me.
I'm going to go look especially for that. But I would suggest, Premier, that we've had persons putting pictures like the things on their clothing and so on, and we rejected it. So there's a very vigilant team. I'm not going to say that one won't pass, but certainly not a lot more than one. So thank you.
Thank you for making me aware of that. I think we'll put something in the legislation to find people who cause us to use resources that, we can be using otherwise. But thank you, ministers, Honorable Minister of Health, Honorable Minister of Tourism. I don't think you have much questions for me. I brought the experts in their areas for you. But to say, of course, you know that the public service is managed by the Deputy Governor. And while we are in phase 3, we're still trying to we're still under law achieving social distancing. So I know that there are plans afoot to continue with even the shift systems and how we work and make sure that people have their hours and the particular skills and services that people need are available when they go to the government offices. You can appreciate in some offices it's very easy to achieve that, others may not be. So we are still, as much as possible, and I want to say this to the public, those who can work from home, we still are encouraging you to work from home, particularly those with underlying conditions. So she would be able to respond to that, the Deputy Governor, and I will ask her to do so for you. Any questions for me? I think one important thing I should have said is that I extended an invitation to the Leader of the Opposition as well to have a walkthrough of the airport, which he did together with his party's deputy leader. I would have had a brief conversation with him. I expect some correspondence, and I don't think I'm talking out of turn when he has some questions about protocols. So just to make sure that we appreciate that this is indeed a national response, we need to make sure that persons don't see this as a government thing or an opposition thing, but everybody's thing. So we would put him in touch, certainly with the health personnel who would want to respond, I'm sure, directly to any concerns he have as it relates to health protocols. So we are open in that regard, and we want persons to understand that this is all about all of us. So that is important to note as well. Anyone other than Mr. Andrew Hamilton have a question? Good, then you can go right on. We continue with the DeAndre show.
It's just one more question, really. I don't know if it's for the Premier, but maybe you can respond to it.
Yeah.
It's related to returning residents who may be from Caribbean countries where it's maybe a challenge to get those, the negative. Is there any thought at this point to perhaps extending that 5 days? I know we just giving on the table now to be extending that time, Frank?
Persons have to understand with every day you're increasing your risk. We're at 5. When we started at 72, it was not difficult to achieve. But when we had the outbreak, as we do in our source markets, of course, because of the outbreak, the resources are diverted towards persons who are symptomatic. But we're not minded to move from 5 days now, because the longer out we go, the greater our risk is, and we have to bear in mind our capacity here in Turks and Caicos, so we're not minded to do that. We do have the challenge that was raised already by the head of the public service in some of those countries where persons can't easily get tested, who are coming to work for government, how we can see about making arrangements for them in country. country of origin to be tested to come to Turks and Caicos. But many of them are able to get it. It's the time. But it's not as bad as in our source markets in North America. Good. Well, thank you, everyone. Have a good afternoon.
You too. Thank you.
I'm going to invite all the ministers so we can get one shot with all the ministers ready for reopening. Please mask up. And I'm saying mask up not because anybody is here without. Honorable Go-Ray Ewing, Minister of Home Affairs, he's working extremely hard with the ministry in terms of preparing for the transportation sector. You would have seen the presentations to the transportation sector on Saturday. So his team is continuing with inspections. We've done over 125 taxi cabs and private transfers. So we're good to go there. The Minister of Education, of course, is readying as to whether her children will be ready for September. We don't know as yet. Of course, the Minister of Tourism you've seen here. The Minister of Immigration has slipped out for a tad bit. He was here as well. And, of course, the Minister of Health and then our Deputy Premier. So we're all on board supporting the critical agencies and definitely encourage each and every one of us to remember that this is all in our hands. Right, so we're grateful for your attendance this afternoon, and we look forward to you assisting in getting out the message and encouraging our people to be vigilant as we open phase 3 today in Providenciales and lift all restrictive measures, but even more importantly, as we open the borders on Wednesday. So good afternoon, and God bless each and every one of you.